Hello everyone, welcome to Radiology Case Review Series. In this video, we are going to look at images of a teenager who presented to the emergency department with severe headache. Patient initially underwent CT head examination. On the CT head, there is no acute intraparenchymal hemorrhage. There is mild prominence of the lateral ventricles. And as you scroll through, we can see hyperdensity in the intrahemispheric fissure and in the region of superior vermian cistern. If you look at these regions of hyperdensity on sagittal images, we can see this hyperdensity is in the vein of Galen and straight sinus. Appearances are concerning for deep cerebral venous thrombosis. Patient underwent CT venogram examination for further assessment. On the CT venogram, the superior sagittal sinus is opacified, and as I scroll down further, we can see decreased opacification of the right transverse sinus, right sigmoid sinus. We can see filling defect with peripheral hyperenhancement, giving that classic delta sign appearance. The filling defect extends into the right internal jugular vein. We can see normally opacified left internal jugular vein. Sagittal reformats from CT venogram shows normal opacification of the superior sagittal sinus. We see non-opacified vein of Galen and straight sinus, confirming deep cerebral venous thrombosis extending into transverse sinus, sigmoid sinus and internal jugular vein on the right side. Patient subsequently underwent MRI brain examination. On the axial FLAR images, we can see edema in bilateral thalami in the caudate nucleus on the right side and lentiform nucleus on the right side. On the axial DW images, we can see restricted diffusion in the right thalamus. Appearances are consistent with evolving venous infarction and edema. On the axial SW images, we can see marked congestion of deep medullary veins due to cerebral venous thrombosis. Patient underwent catheter angiogram and venogram for further management. So the contrast is being injected through the right common carotid artery. We can see normal opacification of the arterial system. On the venous face, we can see opacification of the superior sagittal sinus, left transverse sinus, sigmoid sinus and left internal jugular vein, whereas there is absence of opacification of the deep cerebral venous system, right transverse sinus, right sigmoid sinus and right internal jugular vein. Similar findings on the sagittal views. We can see normal opacification of the arterial system. On the venous face, there is opacification of the superior sagittal sinus, transverse sinus and sigmoid sinus on the left side, but there is absence of opacification of the deep cerebral venous system. Patient underwent mechanical thrombectomy and had good outcome. So our patient has cerebral venous thrombosis. This is an excellent review article. If anybody is interested, can refer to this article. Few salient points from this article. In terms of MR imaging, we have to assess the thrombus, the veins, parenchyma, optic nerves and sella for findings related to deep cerebral venous thrombosis. As we saw in our patient, we can identify filling defects in the deep cerebral venous system and dural sinuses. With regards to parenchymal findings, as we saw in our patient, there can be edema due to combination of venous infarction and venous congestion. In some patients, we can also have hemorrhagic conversion of the edema and infarction. We can see subarachnoid hemorrhage classically in the parasagittal regions in the setting of superior sagittal sinus thrombosis. Because of the elevated intracranial pressure, we can see dilatation of optic nerve sheath on MR imaging, and due to elevated intracranial pressure, we can also have empty cella configuration. It is important to recognize that hyperacute acute thrombus, which is less than 5 years old, may be occult on T1 weighted and T2 weighted imaging, which is why it is important to pursue contrast enhanced MR venogram whenever there is high clinical suspicion for cerebral venous thrombosis. I hope you found this case to be interesting and informative. Thanks for your attention.